Hello guys, this is Talia doing a video on intermittent fasting and type 2 diabetes. So, what is intermittent fasting? Many diets focus on what to eat, but intermittent fasting is all about when you eat. With intermittent fasting, you can eat during a specific time. Fasting for a certain number of hours each day, or eating just one meal a couple days a week, can help your body burn fat. So basically, intermittent fasting is all about an eating plan that switches between fasting and eating on a regular schedule. So my research topic will be, can intermittent fasting improve type 2 diabetes? This review summarized the evidence of the health benefits of intermittent fasting. Intermittent fasting regimens influence metabolic regulation through effects on circadian biology, the gut microbiome, and modifiable lifestyles behaviors, such as sleep. On the circadian biology, organisms has evolved to restrict their activity to the night or day by developing and circadian clock to ensure that physiological processes are performed at the optimal time. The time of days plays a major part in integrating metabolisms and energetics, such as hormonal secretion patterns, physical or coordinations, and sleep. Feeding signals appear to be dominant timing cue for the rhythm of clocks, including those that control metabolic pathways. So that being said, consuming energy outside of normal feeding phase, such as late night eating in humans, may reset some clocks and disrupt energy balance. On the gut microbiota side, many functions of the gut tract exhibit robust circadian rhythm. For example, gastric emptying and blood flow are greater during the daytime than at night. Therefore, it is possible that the chronic disrupt circadian profile may affect gut function and impair metabolism and health. Sleep can be hardly influenced by intermittent fasting too. Numerous studies has report that nighttime eating is associated with reduced sleep duration and poor sleep quality. Especially, eating meals at abnormal circadian time, such as late at night, is hypothesized to lead to circadian desynchronization and subsequent disruption of normal sleep pattern. For energy intake study showed that even a 1 day's fast or 75 calorie restriction was shown to reduce calorie intake by approximately 30% during the subsequent 3 days. Skipping breakfast showed no increase in food intake at lunch after the prolonged morning fast or showed no increase in post-lunch appetite. For energy expenditure, the study demonstrates that time-restricted feeding regimen increased locomotion and improved circadian activity rhythms. The study from 2013 that published on British Journal of Nutrition found that intermittent fasting improves insulin sensitivity and control weight better than calorie restriction. The second study, which is on the left-hand side of the slide, shows a recent study of obese men with pre-diabetes found that early time-restricted feeding, which means eating only during an early 8 or 10 hours period of the day, starting at 7 a.m., significantly lowered insulin and improved insulin sensitivity. If you are struggling with pre-diabetes or type 2 diabetes, there are evidence that intermittent fasting may be helpful to your treatment. This study on the right-hand side of the slide is a study published in 2018 by British Medical Journal. Study found that intermittent fasting had significant benefits for people with pre-diabetes or type 2 diabetes. The patients followed 3 24-hour fasts per week for a couple months. In the study, all 3 patients eliminating the need for insulin by initiating a therapeutic fasting regimen. They all succeed within a month. One of them even uses 5 days. So, result of intermittent fasting for type 2 diabetes. It's based on 2018 study, which is on the previous slide. 100% of patient studies were able to stop their insulin therapy within 3 weeks while managing blood sugar level. Blood sugar level for normal person is below 5.7%, while pre-diabetes patients have 5.7 to 6.5%, and diabetes patients have 6.5 or higher. Two-thirds of the patients stopped taking medication for type 2 diabetes, and 100% of patients reduced hemoglobin H1C, also known as HbA1c levels. A1C is the best measurement of your blood glucose control that we have now. It tells you what percent of our hemoglobin, which is the protein in red blood cell that carries oxygen, has glucose sticking to it. Less glucose that remains in the bloodstream leads to lower A1C, which is better situation for diabetes patients. The chart is based on American Diabetes Association target level. Now we look at the chart at the bottom of the page. People with diabetes usually have fasting glucose 80 to 130 milligrams per deciliters. People without diabetes have 70 to 99 milligrams per deciliters. And for glucose level 2 hours after a meal, people with diabetes have lower than 180 milligrams per deciliters. People without diabetes have a larger 180 milligrams per deciliters. For hemoglobin A1C level, people with diabetes usually have lower than 5.7%. People without diabetes usually have lower than 7%. So, here are some tips for intermittent fasting when you have diabetes. If you have diabetes and are thinking of trying intermittent fasting, here are some tips for you. First, talk with your health care provider about adjusting medication or insulin dosage. You may need to change your diabetes treatment when trying a diet that could affect your blood sugar level. Second of all, monitor your blood sugar levels. Long period without eating can cause blood sugar to go too low, so check your blood levels often. Third, check in on your mood. Many people find that restricting food intake can really affect their mood. Watch for signs that increase anxiety and difficulty coping with stress. Fourth, monitor energy level. Fasting can make you feel fatigue. Sometimes you might want to keep in mind if you're driving or operating equipment. And last but not least, balance your carbohydrates. Your body breaks down carbohydrates into glucose, which can lead to a spike in blood sugar. When you're not fasting, try to balance stretchy carbohydrates in your meals with vegetables and protein to avoid high blood sugar.